Did you know that medication that you buy over the counter without prescription can be raising your blood pressure, or it could be making your current blood pressure medication ineffective? Hi everyone, my name is Anastasia and welcome to my channel. If you've been here before, thank you so much for coming back. If you're new, come on and make yourself at home. Here we talk about everything. So, did you know that medication that you buy over the counter without prescription can be raising your blood pressure, or it could be making your current blood pressure medication ineffective? So in general, most over-the-counter medications are safe to take, but it's good to be aware of which ones aren't safe or can be affecting medications that you're currently taking. So come on in and let's have a chat. The first culprit that we're going to talk about is decongestant. Decongestant that we find commonly in cold medicine, cough medicine, things like that. So the two culprits that I want to talk about are pseudoephedrine and phenylephrine. So they work by narrowing your blood vessels to help with decongestion. And unfortunately, through the same mechanism, they can narrow your blood vessel and raising your blood pressure. So when you're taking a blood pressure medication usually works by dilating, by opening up your blood vessels and dropping your blood pressure. So if you're taking something that's constricting your blood vessel via nasal decongestion, whilst your blood pressure is going the opposite, it's working against each other, and we don't want that. So we have to be aware. And one way of being aware of this is that when you go to buy any cold, cough medication, fever medication, reading the label and checking to see if it has any decongestant in it, like pseudoephedrine or phenylephrine in it. Number two are NSAIDs. NSAIDs are non-steroidal anti-inflammatory medication. Ibuprofen, naproxen. Ibuprofen is over the counter. And those two medications, the NSAIDs in general, they work by the kidney retains a lot of sodium and water when you take non-steroidal anti-inflammatory medication. So if you have uncontrolled hypertension, if you have any kidney issues, definitely talk to your healthcare provider before you take any over-the-counter medication. Next are herbal supplements. So herbal supplements are not regulated by the FDA. So they're not properly checked for safety and efficacy. So something like licorice root, not the candy, like the herbal supplement licorice root, can actually raise your blood pressure. So, just always make sure if you're taking any supplement over the counter, make sure that you're letting your primary care provider, your doctor, know what over the counter or herbal supplements that you might be taking. Next is over the counter weight loss medication and energy tablets or energy pills. They have those over the counter medications that's supposed to give you energy, and it's all just high dose of caffeine. So if you already have high blood pressure and you're taking something like that, like a weight loss medication that's over the counter or some like an energy booster type of thing, a majority of them are high in caffeine. So please make sure you are reading the package. Even if it says natural on the package, you have to read the ingredients to see what exactly the natural ingredients are, because it could be causing you more damage than good, especially if you're already taking prescription medication for blood pressure. If you're not sure, call your doctor's office and say, hey, I'm trying to take this. Do you recommend I do? If they don't take it. It's not worth it to try to do something for yourself that's not actually healthy. Lastly is acetaminophen or Tylenol. So a lot of people that cannot take the NSAIDs, the ibuprofen, will opt out for Tylenol. However, or acetaminophen. However, if you have liver issues, because Tylenol or ibuprofen, sorry, there's a lot of construction going on. majority of your acetaminophen is metabolized in your liver. So if you don't have proper liver functions, if your liver functions are not good, or if you have any liver disease, taking acetaminophen over the counter might not be best for you. So definitely check with your provider. So how to shop for proper over-the-counter medications. Safe ways to make sure you're shopping for things that might actually be good for you is reading the labels and making sure that you know exactly what you're taking and your provider is okay with it. Next is, if you're not sure of what the ingredients are, or if you're not sure if it matches with whatever medications that you're currently taking, ask your pharmacist. The pharmacists in the stores, in the pharmacy stores, they are there to answer all your questions. So if you're not sure about any medication, I would definitely recommend using the pharmacist at the store. They're a great resource that a lot of patients tend to forget to use. So use your pharmacist. Read the active ingredient on the medication. Like I was saying about Sudafed, if you just look at the package, you're not going to know. So turn the package and look at the actual active ingredient in the medication. It's all there on the box. So read it and make sure. Don't just follow the brand and just say, oh, it's, whatever the brand is, Tylenol, it's okay. No. If acetaminophen is not good for you, if your doctor has told you do not take acetaminophen, then you shouldn't be taking Tylenol. So it's not just the brand name, but look at the active ingredient in the medication itself. Avoid taking multiple over-the-counter medication, especially the cold medications at once. If you're having cold, flu symptoms, take one medication that you know the active ingredient is good. Don't take Dayquil or don't mix medications, especially over the counter medications. Don't mix them. Take one at a time. If this one doesn't work, give it time. If it doesn't work, then you can switch it to something else versus combining everything together and then you don't know which one is giving you the problem. Lastly, if you already have high blood pressure, then definitely check with your doctor before you start any over-the-counter medication. When to call your doctor if you're taking an over-the-counter medication and you think it might be causing problem. First, if your blood pressure is higher than usual. So if your blood pressure, everybody's blood pressure is different, and especially if you're already taking blood pressure medication, then it's already on the high side, hence the reason why you're taking the blood pressure medication. But if your blood pressure raises more than what it is, even with the medication, definitely let your primary provider know. If you develop any headaches, dizziness, nausea, vomiting, call and let your provider know. So, in conclusion, knowing the active ingredients in your medication can help you make safer choice for yourself and your family. I hope you found these 5 medications helpful, these 5 tips helpful. Please leave a comment down below if there's any other health questions that you're not sure of, any medication that you're not sure of, or any topics that you want to discuss. Please leave it down below. If you've taken anything in the past that had given you problems, leave it down in the comments below so we can all learn from each other. Please share this video, give it a thumbs up, leave an emoji, all the good stuff. Thank you so much for watching, and I'll talk to you soon. Bye.